Hello, and my name's Natasha Kozarski. I'm the National Programme Manager for Return to Practice for those looking to return to the Health and Care Professions Council Register here at NHS England. So we run a programme of support that supports returners on their self-directed return back to the register. And I'd just like to share with you a Slido poll that we did recently with our returners, which I think you can see shows a mixture of emotions that they're feeling as they embark on their return to practice journey. You know, they're feeling excited and proud, but also a bit nervous, a bit apprehensive, and quite overwhelmed often as well. So it's really important that we support our returners and give them a good return to practice. What you'll see on the screen as well is a quote from a returner that returned after a fair period of time out of practice, but I think really illustrates what many returners find when they return to practice, which is actually there are many things that they need to refresh and update in, but there are also things that have actually remained the same, you know, and they've got a lot of transferable skills that they can bring back with them into the workplace. On the right of the slide, you'll see our Return to Practice webpage as well, with lots of information on. So if there's any questions that you might have, you might find the answer to those on our webpage. There's also a tile on there that if you have a returner that wants to sign up to the programme, you can direct them there to start the sign up process as well. So the next slide, I just wanted to share with you, I'm not expecting you to be able to read this because it's a lot of data and a lot of small figures, but essentially I just wanted to illustrate that we do collect data on the programme about our returners and how many we have started and completed on the programme. So just to give you some figures, we have over 550 starters on the programme at various stages of their journey at the moment. And over the life of the programme, we've returned over 1,000 returners back to the register. So why should you as an organisation or a system bother with return to practice? Well, it does offer a solution to workforce supply unlike any other route, because it brings back a wealth of experience in a relatively short space of time for relatively little cost as well. So supporting a returner can provide a significant return on investment, and it allows us to tap into a skilled workforce, because when a returner is looking to return, they have about 9 years of experience in terms of NHS and care experience before they're looking to return back to practice. I think the other thing to say as well is when they left practice, they will have been doing other things, and they will be bringing back with them a lot of transferable skills as well, which can be really helpful to bring into the workplace. It allows us to address workforce gaps and hard to fill positions as well, and it can help us to reduce recruitment and agency costs and increase our bank capacity. And I think the other thing to point out as well is obviously supporting a returner allows you to bring somebody back into the workforce relatively quickly, and then you've then got an experienced member of the team who can then support other staff members coming in from other supply routes, such as like newly qualifieds, for example. So it really is a relatively quick win for the workforce supporting return to practice. So what I'd encourage organisations and systems to think about is, how do we welcome returners back? We know that in order to retain staff and to retain our returners on the programme, that we need to nurture them and support them and meet their needs as they return to practice. So thinking about what pastoral support or preceptorship support you have in place that you might be able to offer a returner, and what flexibility you can offer them in terms of their working pattern, for example, as a lot of our returners are looking for that flexibility when they return to work. I've just shared with you a case study that we've produced recently of one of our clinical psychologist returners as well, and we have an awful lot of resources available on our website and our stakeholder national SharePoint as well, that you can use to advertise for returners to help to entice them to come and work for your organisation. So on this slide you can see return to practice events that have happened, adverts on Twitter, a advert that went out on the back of buses for return to practice, and another advert there from the Metro. So you can see there's a real broad spectrum of options when it comes to advertising, but it doesn't have to be a costly thing. It's something as simple as, have you got a presence on your organisation's website? Do you have a section on return to practice, for example? And that can be really helpful with a contact email address for the returners to find you. So what do we offer in terms of support from the NHS England Return to Practice programme? So for you as an organisation or a system, we offer you a quick guide to supporting a returner and the steps that you might want to think about when supporting a returner on a supervised practice placement. We offer you advice for individual queries. We offer a £500 claimable amount by eligible supporting organisations for supervised practice placements. We have a national SharePoint platform for stakeholders to the programme as well, and on there you've got things like job descriptions or other adverts from other organisations, and other things around the supervisor role as well that you might want to have a look at. We also have a database of organisations that we host on our returner SharePoint site. So if your organisation or system is not currently on that database, we'd be really happy to hear from you and to put your details on that site. And the reason we have that is to allow returners to more easily connect with individuals in organisations to facilitate their return to practice. We've also produced a communications toolkit for advertising or for events you might be running around return to practice, and this is available on our return to practice website as well. If you haven't already had a returner on a return to practice placement and you're feeling a bit unsure as to the process, we would signpost you initially to the quick guide, but if you've had a look at that and you've still got some questions, please do contact me at the return to practice inbox, because I'm really happy to pick up the phone and ask you, pick up the phone and ask you what your challenges are, and help you to work through those to support the returner as well. So for the returner, we offer them support along their self-directed return. We give them access to up to £800 for eligible out-of-pocket expenses. We give them access to e-learning for health formal courses as well. And they have access to our national SharePoint platform with lots of resources on to support their private and formal study. There's also on there some templates for supervised practice, so recording their hours, and also recording supervision sessions that they may have with their supervisor as well. We give them access to the database, as I said, with all the organisation contacts on. We connect them up with regional colleagues to help them to build their networks up again. And we also have some commission projects to support their return. So for more information, if we've piqued your interest today about return to practice and you'd like to find out more about how you might go about supporting a returner or advertising for return to practice, please drop me an email on our return to practice inbox address or visit our website for more information. If you are posting anything on Twitter, we do encourage people to use the hashtag #IamReadyToReturn. And again, just sharing some more resources with you on that slide that we have available for you to use to promote return to practice within your locality. Thanks so much for listening today.